Good afternoon. My presentation today is on the parasitic infection Trichomonas vaginalis. Trichomonas vaginalis is the protozoan parasite responsible for the sexually transmitted disease trichomoniasis. In 1836, Alfred Francois Dunn, a French physician and bacteriologist, was the first person to describe the protozoan parasite he named Trichomonasis. He presented his discovery to the Academy of Sciences as animalcule observed in purulent fluids and secretions of genital organs from men and women. It was later given the specific name Trichomoniasis vaginalis by a professor of protozoology who pointed out that its human habitat was vaginal. It was originally believed that the trichomonads were harmless and ubiquitous, so other sexually transmitted diseases such as gonorrhea and syphilis became the focus of scientific research and treatment. Today, trichomoniasis is recognized as the most common sexually transmitted disease in the world. Trichomonas is a single-cell anaerobic protozoan parasite that is roughly the size of a white blood cell, or about 10 micrometers in length and 7 micrometers in width. It has a pear-shaped body with 5 long flagella. 4 of these flagella extend anteriorly and one runs posterior along an undulating membrane. The organism's nucleus lies in the anterior portion with an axostyle extending from the nucleus through the posterior aspect. The axostyle, which is formed from a rigid sheet of microtubules, appears to be barbed at the end and is thought to help anchor the parasite to epithelial cells. The flagella, undulating membrane, and whip-like axostyle give this organism its motility. This microorganism has a cytoskeleton composed of tubulin and actin fibers, which helps give it structure and flexibility. The parasite can flatten itself into an amoeboid form to tightly adhere to vaginal and urogenital epithelial tissues. It then lyses the target cells and obtains nutrients from the cellular debris via phagocytosis. The organism lacks the enzymes needed to synthesize purine and pyridamines, so it has to obtain them through salvage pathways. It also lacks a mitochondrion and requires a nutrient-rich environment in order to survive. It uses the nutrients it obtains through phagocytosis, where enzymes in the cytosol convert these food sources into usable energy via glycolysis. Due to the changing environment of the vagina and urogenital structures it lives in, the trichomonad uses half its energy just to maintain homeostasis. In these microscopic images of trichomonads, you can see its various shapes. In slide A, you can see the pear-shaped body of the trichomonad. At the top part, you can see 4 flagella coming out, and then the membrane along the back and the axostyle coming from the posterior portion that would attach itself onto epithelial tissues. In slide B, you can see it laying against epithelial tissues, and the second one in the back is starting to flatten itself out. In slide C, you can see the trichomonad take on that amoeboid shape and flatten itself completely against the epithelial tissue to start phagocytosis in order to get nutrients. The trichomonads reproduce asexually. They divide by longitudinal binary fission. The parent cell gives rise to the daughter cell, and they separate. The tropocytes give rise in the lumen and the mucosal surfaces of the urogenital tracts where they live. Left untreated, they can survive for months to years within their host. They cannot survive very long outside the body, as this parasite does not have a cyst stage, and this makes the tropocyte an obligate parasite that requires a human host to thrive and reproduce. Disease transmission occurs from infected person to uninfected person during sex. This can be any form of genital to genital contact. Symptoms may appear in 5 to 28 days or not at all, and symptoms can come and go. 70% of people remain asymptomatic, so this means that only 30% of infected people have symptoms. So most people do not know they have the disease and keep passing it around. The CDC estimates that 3.7 million people are infected with this parasite at any given time. Symptoms are more common in women than they are in men. The parasite most commonly affects the lower genital tract and can cause the following symptoms: vaginal discharge, an odor, itching in the genital area, dyspareunia, dysuria. It also causes an increased risk of HIV and cervical cancer, as well as pregnancy complications in the form of preterm delivery and low birth weights. Problematically, most men remain asymptomatic. If they do have symptoms, these can include itching or irritation inside the penis, unusual discharge, mild dysuria, an increased risk of HIV, and an increased rate of prostate cancer. This parasitic infection is treated with antibiotics, usually metronidazole or tinidazole. All sexual partners need to be treated, so all sexual partners need to be contacted and make sure that they see a doctor and get treated as well. It's important to complete the full course of antibiotic therapy and get retested to make sure the parasite is no longer present once you've completed the course of antibiotics. Most important is abstinence should be practiced during therapy, and always, as prevention, practice safe sex. Thank you for your time and attention today.